So, on behalf of Shivadarshan Yoga Vidyalaya and our Swamijis, we welcome all of you for this webinar. This purpose of this webinar is to highlight the importance of yoga therapy and also to go through why yoga therapy is required, why it is important. And if you want to pursue yoga therapy, in what way you can make use of our courses, which is going to start in a week's time. So I'll share some few slides about the yoga therapy and the importance of it and all those things. The first half an hour we'll be discussing about general yoga therapy and psychosomatic disorders, the importance of psychosomatic ailments. And the second half an hour will be dealing with the disorders or the ailments faced by females. So the ailments like menstrual disorder, menopause, all those things we'll be taking in teacher training course 2, which will be dealt from 8 to 8:30 by another speaker. So now we'll take care of, we will see about the teacher training course 1, the subjects we cover and the importance of yoga therapy. So most of us join yoga therapy in any institute, and especially in our institute, should be a yoga teacher. So hopefully many of you are yoga teachers, or if you are practicing yoga for some time, if you are familiar with asana, pranayamas and all, you can attend our teacher training course. So to understand more about the therapy, if you are a teacher, then you suggest yoga practices for these people? If somebody asks, you can do that, right? For kids, the yoga practices are different. And for youngsters, the practice will be different. Similarly, for middle-aged and old people, yes, you can do. Because when you say the yoga practices for these people, that means it's a general yoga. It's not related to therapy. So any teacher can always suggest. But the same question, if we ask, can you suggest yoga session for these persons who is suffering from any ailment? Then the question arises, do I have knowledge to suggest a yoga plan or get a class for these people? So in this case, the yoga teacher, the knowledge of a yoga teacher will not be sufficient. You need to be a yoga therapist, because there are many simple asanas which should not be done for a heart patient. Many asanas should not be done. So similarly, based on the ailment, the yogasanas and pranayama or any techniques differs. So you have to be a yoga therapist if you want to suggest any yoga to these people who are suffering from ailments. So what is the first thing when you go to an hospital? What is the first thing they will do? Even if you go for a small clinic for a headache, still they will take the blood pressure. How much your blood pressure? Because the blood pressure plays a major role in our body. And this should be the first disease to be addressed. Even somebody gets into an accident, if they go taken to the hospital, first they will check the blood pressure, they will stabilize the pressure, then only they will do treatment. Without stabilizing the blood pressure, if the treatment starts, then it will not support the patient. So if you take in our course also, the teacher training course 1, high blood pressure is the first subject. So we have high blood pressure, asthma, diabetes, spondylitis. So these are the 4 diseases we cover. And why high blood pressure first? This is because of the reason the blood pressure has to be normal. It has to be under medication and normal. Then only other diseases has to be addressed. These are the simple basic rule to be followed. So every disease has its own limitation. For example, somebody suffering from high blood pressure, whatever asanas you know, the 90% of that asana should not be done by that person, because this will not support, this will increase the blood pressure. So these are all when I studied this course in 2020. I finished in some other place, a 2 years teacher training program. Then I came here, Shivadarshan. I thought 2 years, okay, I studied. Maybe there will not be any big difference. But the first TTC one I did, then I came to know whatever I studied, the asana, pranayama, most of it should not be given to high blood pressure patient. This is a big knowledge, because in these days, BP and high blood pressure and diabetes are most common. If you start giving asanas of our own, it will increase these ailments. Similarly, if somebody is affected by diabetes, what we have to do? We have to give asanas so that the pancreas should be activated. Now you may ask, what is the pancreas and all, which we will be covering in our teacher training course. So what we do normally in our course is give a complete theory about that part where the disease is connected, and also then we will train the teachers to study the proper pranayama, asana and pranayama and other techniques so that it can be given to the patient. Now, what a yoga therapist should know, if you want to become a yoga therapist, what is that you should know? What we are expected to know is anatomy and physiology about the affected parts. Now, somebody is having high blood pressure, you should know about the heart. Without knowing the heart, if you start giving asanas, maybe by accident, you may be correct. But most of the time, we may go wrong. So, we always give equal importance to theory and practice to understand that specific part. So, high blood pressure means the heart, diabetes means pancreas. Like that, we need to focus. We should know anatomy and physiology of that part. Symptoms of the disease. Somebody is coming and telling you, I have a headache, I have anxiety. You should know what this is connected. What are the symptoms of the disease and which part it is connected. And we also should know the in-depth knowledge about each and every disease. That's why we don't teach all the disease. Whichever can be taught through online. So these are the 4 diseases in TTC 1, the teacher training course 1. That is high blood pressure, diabetes, asthma, spondylitis. We take only the 4 diseases. And the basic knowledge about the modern management or allopathy point of view. We also have doctor's lecture on every subject in our course, so that you will get both perspective of yoga and the allopathy point of view. And what is a yogi cure of the disease? So I've understood the disease now. What are the yogic practices I can give for this disease? So what asana, pranayama? In fact, we also teach Shatkarma, Lagu Shanka Prakshalna. It's a complete alimentary canal washing we give. And Yoga Nidra and meditation are compulsory subjects in our teacher training course. So how to give all those things we'll be teaching, and what not to give. There are certain asanas you should not give for certain ailments, and how to give with little variation. So, variation not to 100%, at least to some extent, how to vary things will be giving, and how to integrate breath in asanas. And about last thing is about food. What food to eat, what food to be avoided. These should be known. If you are a yoga therapist, you should know all these things, without which giving yoga therapy is not possible. If you see the courses, what our Swamiji has designed, all these diseases are psychosomatic ailments. Psychic means mind, soma means body. These are the ailments caused to the body because of the mind. Because the mind has stress, the mind is not good, the body has got the diseases. So we should understand even the high blood pressure, diabetes, asthma, spondylitis, and what other diseases you are going to see after 8 o'clock, 8 to 8:30. All these things are psychosomatic ailments. So if you keep your mind healthy, the diseases, you can keep it away. So what is the definition of psychosomatic ailments? Disorders in which there is real physical illness. That means any ailments to the body that is largely caused by psychological factors such as stress and anxiety. So these days, the stress has become part of our life. You cannot avoid stress. That's what people say. So because of stress, after many, many years of living in stress, you get all these problems. So this is a basic understanding we should get. Otherwise, if you start simply eating a pill, taking a pill and live, you have to take pill for lifetime. So most of the psychosomatic ailments or the mental worries or stress, it is caused by stupidity. Now you'll be wondering, am I stupid? Most of us are. You'll understand now why. Now, suppose there is a monkey. If you show to a monkey banana and money. Which the monkey will choose? Can anyone answer? Which the monkey will choose?
Banana.
Why, madam? Why banana?
Because
The monkey do not know how
we
to
not know the value of money.
value of money. Because if you have this money, you can buy many, many bananas. But the monkey don't know about it. It have limited knowledge. It will choose banana, right? So we cannot call monkey a stupid, right? Monkey is doing on its own. It will select only banana. Suppose there is a human being. You keep money and health in front of it. What human being chooses? What a normal person choose? Definitely money, right? But we should also understand when you have good health, you can earn more money. This we know, all of us know. When we have good health, you learn money, but we neglect it. Oh, health, I know, bro, no problem. I don't want to eat. I will take just tea and biscuit. I will skip my, food. I will not do yoga. I will not go for walking. Why? I'm so busy in earning, but you don't understand. When you have good health, you can earn a lot. But he will not only choose as money, he will go and grab on it. The whole life goes for earning, neglecting health. One day you will get into problem of health. Then you will start spending. This is what is happening. Now tell me, if this is an intelligent way to live? This is stupid way, right? When you don't focus on your mind on health, only on money, this we call as stupidity. Now, sometimes most of us, means all of us come from monkeys. So the science says there is only 1.23% difference in genes between monkey and us. That 1.23% only makes a huge difference, though it is small. So most of the times we behave like monkeys, not using our intelligence or intellect. So we should wisely choose. All of us know health is what is required, but we don't choose. If we avoid this stupidity and spend little time on good health, learning, we have to learn, we have to practice, and we have to teach to somebody. If you spend little time, then we can make a huge difference to us and to the society. So what is the root cause of all the diseases, including mental, physical? What are the root cause of diseases? We'll take an example. Suppose two people are neighbors, have a car, and one person, whenever he goes out, he always meet accident. The other person drives and he don't make any accident. He joyfully rides. Very safe ride happens. So what may be the reason why one guy is meeting with accident, other guy is not? It may be due to two reasons. One is car is not in good condition, right? When you have a problem with the car, whenever you take it, will break down or you will meet with accident. Or I may not know how to drive it. I lack the driving skill. If I am not a good driver, I will end up in accident. Correct? These two are the only reasons. Similarly, suppose in our life we are meeting accident. That means what? Our body is a vehicle. This body and mind are the vehicle. If I am having problem with my body and mind, that means what? I am not maintaining my body. I am not maintaining the health of my mind. If we do these two things, then problems will not arise. So if you see the mind or the brain by modern terms, we have to understand it from disease point of view. What are things it affects? To understand the brain, we should study the brain. We should know the mind. What is this mind? How it gets affected? All those things. So have we studied the user manual of the mind? No, we never, right? We don't know where the user manual is. When we understand what is mind, how it affects and all those things, definitely we can avoid many diseases. So yoga helps us to find the user manual and read it. So when you practice, you are practicing the mind. Don't think like I do only asana practice. No, asana also connected to mind. Pranayama directly connected to mind. All the yogic practices are connected to mind. When you start exploring your own user manual through your mind, then all the mental ailments can be overcome. So we do asana. Why we do asanas? The asanas helps us to get a smoother flow of blood. The blood has to flow to all parts of the body to avoid any disease. We call this as flow of prana, the life energy. If the prana flows freely throughout the body, then most of diseases will not come. Prana can be taken, the life energy can be taken inside our body through oxygen and through the flow of blood. So when you do asanas, you are making sure the blood is circulated uniformly throughout the body so that no body parts suffer lack of oxygen. And not only oxygen, the blood also carries nutrients, right? All the nutrients absorbed from the food has to reach the body. Then when you do pranayama, what you're doing is you're trying to control the mind. One, through asana, I take control of the body, right? Body parts, I control all the parts in the body, start functioning well. When I start doing pranayama, I will start controlling my mind because the breath and mind are directly connected. Whenever the mind is agitated, the breath is agitated. Whenever the mind is relaxed, the breath is also relaxed. So the pranayama helps us to take direct control of the mind. Now, the stress. What is meant by stress? So stress is between the gap between the expectation and the reality. I have this much expectation, very high expectation, but my reality is very low. Whatever happens is low. Then I get huge stress. Every day we have expectation, right? We have expectation from our office, from the society, from everyone. We have expectation from life itself, but nothing happens 100% our way. When you don't come into terms with the reality, then the stress will lead to all these psychosomatic disorders, high blood pressure, diabetes, asthma, and spondylitis. So what is the stress? Why it is important to understand psychosomatic disorder? We have two beautiful nervous system. There is a autonomous nervous system under which there is a two beautiful nervous system. As of now, let's say nervous system A and nervous system B. What is this nervous system A and B? In the nervous system A, this helps us to do activity. See, if you want to walk, if you want to run, this nervous system has to work. If you want to work using your physical body, this nervous system is helpful. But if you want to sleep and if you are eating, you want the food to get digested, then you should get this nervous system B to work. So these are complementary to each other. So one is for fight or flight mode. That means if you want to do any activity in your life, nervous system A should function. If you want to take a rest, and B, the nervous system B should function. This is all created by God. But what we do normally is we always give nervous system A more importance. We don't know how to activate the nervous system B. The nervous system A is called sympathetic nervous system, which is responsible for activity. Any physical activity means you need sympathetic nervous system. Now I am talking, you are listening. If this function has to happen, sympathetic nervous system should work. But today night you are going to sleep. Then sympathetic should off. Then parasympathetic nervous system should work. Then only you can sleep. Now there is an imbalance happening because we are having too much activity for the mind, less activity for the body. When you do this, then there is an imbalance happens. Now, why I need sympathetic nervous system? Suppose a dog is chasing you or you want to do any activity. You want to walk or run. This sympathetic nervous system has to function. When sympathetic nervous system functions, when you run, when a dog is chasing, what are the symptoms you can see? You can see anxiety will be there, stress will be there, sweating, body sweating will be there, your heartbeat will increase, you will have fear, you will have confusion, all those things will be there, right? Now, suppose you are sitting in your office and your boss is shouting at you. You have too much stress in office. Can you tell me what are the symptoms you will have? You will have the same symptoms. You will have anxiety, you will have stress, sweating, high heartbeat, all those things. Now see, all these things happens because of activity of sympathetic nervous system. That means what? When you have to run, these are required because the heart has to beat more to pump more blood, to pick up more oxygen and circulate throughout the body because body feels there is a danger. When body feels danger, more blood will be circulated, more oxygen will be circulated so that you can run, either fight or flight. Either you run or fight. But the same thing happens when you are at work. Are you going to run here from office? No. So what happens? All these things you are storing in your body, it is converting as a kind of poison and it is turning as blood pressure, diabetes, all those things. Hypertension, diabetes, all those things. So if you have this kind of high heartbeat, anxiety, you have to walk. That's why they say, right? You have the people have gym in the office to work out. To some extent, you can increase the activity and reduce the stress, but there is no equipment in the gym to relax you. So whatever is the emergency response in our body, we are misusing that. See, you are sitting in office, creating all kind of things, sweating, everything, heartbeat increases, but you are not doing any work. This is negatively affecting our body and mind. So what is the solution? Use body more. Go for a walk, do yoga, go for swimming, do any activity and relax completely. These two are required. But using the body more, you can do by many activity. But relaxing the body can be done only through yoga. No other area is there. You cannot relax. So our mind is like the boiling water. The mind is a boiling water, and whatever activity happening in the mind is that water is boiling like this. Now I want to calm the boiling water. What should I do? Actually, I should switch off the flame, right? I need to switch off the mind, but I don't know where the switch is. The flame is on means your sympathetic nervous system is on. The flame is off means your parasympathetic nervous system activates. That means your mind is off. But most of us do not know how to switch off the mind because we don't know the switch. So instead of that, what we'll do, we'll add one more glass of water. When the weekend comes, what we do? We'll add one glass of water. The boiling stops temporarily on Saturday and Sunday. Again, Monday comes, it starts boiling. But through yoga therapy, you will start understanding about the disease, understanding about the mind, so that the mind, the flame, you can reduce or stop. The ailments, you can recover. So what we do most of time is overusing of sympathetic nervous system. Most of the day we are into activity. You know, when the weekend comes, weekend also we are not taking rest. We means I'm talking about the society. Most of the people wants to go out and do action, action, action. So we do less physical action, more mental action. That means what? We have more mental action means more sympathetic nervous system. At least if you relax, listen to a song, go to nature, go to mountain, rivers, wherever possible, relax. That is different. But we don't do, we are overcharging ourselves. Even if you go to a gym or anything, you are not relaxing your mind. You are exhausting your activity. To some extent, it will help you, but not beyond a certain limit. So we should not overcharge. We should not activate our sympathetic system more. If you take an example, what we are doing, I bought a new car, okay? And I filled that petrol tank, full fuel. I start running the whole day. And in the night, I park the car in my home and I am not switching it off. The engine is on. I only park the car. The engine is on. Whole night, the engine is on. And I am not giving my car for any servicing. Changing of oil, anything, no servicing. If I do like this, what will happen to me? The engine failure will happen after a few days. Why? The engine is supposed to stop. You have to stop the engine, give some rest. If I don't give rest, if I don't do proper servicing, my vehicle will not last long. Now, what we are doing with our body? Our body is running 24/7, right? We are just simply eating and swallowing. Rest all body does. Similarly, many things body does. Running, all the day, body is running. Night I'm sleeping, but I'm keeping my mind on. That means what? Most of us are not getting deep sleep, right? You get dreams, right? How many of you don't get dreams while sleep? Is there anyone who is not getting any dream during sleep? No, right? Most of us get dreams. The moment you are getting dreams, that means you are disturbed. Your engine is on. Your mind is your engine. You should keep it off. When you keep it off, then only you will take a proper rest. If you don't keep this engine off, if it is on, you will get all the dreams, then you will not take rest. Only when you keep the mind off, all the cleansing will happen. Only in deep sleep, all our parts will get serviced. This is automatic service. You don't need to pay. Free service happens in our body. All the toxic things are removed. Your body gets a lot of energy. Anytime have you wondered? See, night you start sleeping at 10 o'clock. Morning you get up at 6 o'clock. But you feel so much energy. Energy naturally comes when you eat anything, right? If you're so less of energy, you eat something, you get more energy. But are you eating anything in the night? But how come without eating anything, just simply sleeping, you get more energy? Because of this, your mind takes rest and all the toxic substance in the body are removed. If you don't do this, if you're not sleeping properly, not taking care of the body, then one day, like engine failure, you will get all the psychosomatic ailments. Suddenly you see blood pressure, high blood pressure will be there. Suddenly doctor will say you got diabetes. It is there for 10, 15 years of misuse. We have misused our body more than 10, 15 years. After that only, the body will show all these symptoms. So if you compare yoga and exercise is good. We are not denying that. As far as using the body is concerned, exercise is good. But as far as the rest is concerned, the exercise or gym cannot help. Because in yoga, I can activate both sympathetic and parasympathetic nervous system. Whereas in the exercise or gym, you cannot activate the parasympathetic nervous system. So yoga does everything. So it's better to practice yoga and get the entire benefit. So if you take like, for example, these are like some key takeaway points or the tips, what we teach. For example, in high blood pressure, we teach something called Pavana Muktasana Part 1. And there are few tips like you should not do any inversion asanas. No forward bending asana. If you ask why, there is a whole explanation why you should not do. I think somebody is unmuted. Can you please mute yourself? I don't see who is that. Okay. So what posture I should do and what relaxing asanas I should do, what relaxing pranayamas I should do, because blood pressure, high blood pressure and stress are very directly connected. Your heartbeat and your action. So all these things we'll be covering. And if you take asthma, Pavana Muktasana series part 2 and 3 will be like teaching, and your focus is mostly on the lungs. Lungs and asthma are connected. So all the chest opening asanas should be done. And if you take diabetes, we will teach Pavana Muktasana part 2 and 3. And again, diabetes means it is focusing on the abdomen, pancreas. So again, the breathing practice is different and the asana practices are different. So this we will understand only, we understand the theory part of it, then the practical part of it. So all these things will be taught in detail to the therapist point of view. You don't need to worry. I have not studied any anatomy, physiology or biology. Long time back I studied. You don't need to worry because we'll be teaching from the basics in the course so that you will understand both theory and practicals. In the theory, you will be understanding about the diseases. Why then you will understand why I'm giving this asana to this disease. So you will come to understand all those things. And along with this, we'll be teaching Anta means meditation and yoga nidra, because these two techniques are very important, because this yoga nidra and antar mauna or the meditation technique completely relaxes your mind and body. If you take our Shivadarshan Yoga Vidyalaya courses, every teacher training courses has this yoga nidra and meditation. It's a compulsory subject because for any ailments, you can use these two. It does a fantastic job. Somebody admitted in a hospital cannot do any asana. What should I do? You can give yoga nidra. And it is the one of the speciality of the traditional Bihar School of Yoga and Shivadarshan Yoga Vidyalaya, where we teach. So this is how we'll be taking care of our course. And if you have any questions, 2-3 minutes, you can take time and ask question. Then we'll have a next, we have Pallavi ma'am here to have a next session. Yes, Balamurugan sir, you have any question?
Yes, sir. I'm having can you tell me again about the synthetic, sympathetic, right?
Sympathetic system.
Ah.
So sympathetic system is like Boost or Horlicks. If you take, you have to work. If you want to work something, this nervous system, sympathetic nervous system has to work. Okay. Then only I can do any work. Parasympathetic nervous system is also a nervous system where it will be there, it will work the moment you want to take rest. I want to sleep. Your sympathetic is on means I cannot sleep. You'll be rolling here and there, you will not get sleep. Why? Because the parasympathetic nervous system is not activated.
Okay.
So you have to activate the parasympathetic nervous system to get sleep. We don't use that. Parasympathetic nervous system means we don't activate that. We don't know, there is no technology or no method to activate that except in yoga. So in yoga, we relax your mind so that parasympathetic nervous system is activated, so that your digestion happens better, your sleep quality improves, and all those things happens in yoga nidra. So these two are complementary, not both has to work at a time.
Okay. Okay, thank you, sir.
Thank you, sir. So may I know about what all courses you have in there? And the fees is for 14,000 rupees, ma'am. Each teacher training course is 14,000 rupees. This is like diabetes, this BP, diabetes, asthma, spondylitis, together with yoga nidra and antaram means meditation. This is one teacher training course. Next teacher training course, our Pallavi ma'am is there. She'll be telling you about like menstrual disorder, thyroid, and all those things. So one teacher training course is for 14,000 rupees. Is the fees. It will happen on Sundays. From morning 8 to 12:30 is teacher training course 1, and afternoon 2 to evening 6:30 is for teacher training course 2, where the menstrual disorder and other things are going to happen. So you cannot enroll for both. You can enroll only for one. Anybody can enroll. If you have a little yoga knowledge, if you are a yoga teacher, you can very well do it. Now we'll have a session from Pallavi ma'am. Then we'll take up your question later. Hari Om Pallavi ma'am. Kindly take over the session.
Hari Om, sir. Hari Om. Yeah. Shall I go ahead, Manishri ma'am? Yeah, fine. So I'll share my PPT. Can someone confirm? Is it visible?
Yeah, ma'am. It's visible.
Yes, ma'am.
Yes. Okay, fine.
Ma'am, clear, ma'am.
Right. Thank you. So today, just for a glimpse, I'm just taking this session. So our topic is, it is for TTC2 yoga therapy for women's disorder. Okay, specifically for women's disorder. But do not think that it is only for women, because as a yoga therapist, we both are male and female, both are coming for this course, because we have to give this therapy to human beings, all the humanity. Okay, so everybody should understand what are all the women's disorder, because somebody is having a daughter at home, somebody is having a wife, mother, so all women have having some kind of disorder. So we can heal it naturally by yoga therapy. All right. So myself Pallavi and Shishya of Swamiji. So this is my introduction, and with this we are going ahead. So this is what teachers training course. We have different TTCs, like TTC1 just now Balamuli sir has taken. Then now I am going to take for TTC2, just a glimpse I said. We have TTC like Kids Yoga, TTC3 like prenatal, postnatal, and some other courses are also there, which will be taken by Swamiji. And why does, first of all, teachers training certification is needed? See, now 2 days before, if you would have read the newspaper, the government is going to make it compulsory for all the like integrated courses are there, like integrated therapies are there. They should have mandatory certification. Because nowadays we can see that somebody knows certain yoga poses from online by seeing, and they are simply taking it, and they do not know what will be the consequences of that simply by giving it. So when you come here, or just like to get a, first of all, certification is required to work. Okay, and our center is very, very recognized, so that Vanishri ma'am will give all the information to you. And then government is going to make it compulsory, so you need a proper yoga therapy certificate for that. And then let's start with the yoga therapy for women's disorder. So if you are not from the field of yoga, then let me tell you that we think this physical body is just a body. It just as we are seeing. But if you are having yoga background, they know that we have 5 layers of body. Like one is Annamaya Kosha, Pranamaya Kosha, Manonmaya Kosha, and then Vijnanamaya Kosha, Anandamaya Kosha. Okay, what we are seeing, the physical body, the Annamaya Kosha, it is just we are seeing it is the problem is in this physical body. So I have some kind of like PCOD or thyroid issue. So I think that this problem is in the physical body and it should be healed from the physical body itself. No, it won't happen like this. When you come to yoga therapy, you should go from upper body to the inner surface. Like from Pranamaya Kosha, you should enter to Manomaya Kosha. That is, Pranamaya Kosha is like your energy body. Then to Manomaya at your mind level. Then to your intellect level. Then to your bliss level. So step by step, when you go in, you start healing from the root. If you try to heal only at the Annamaya Kosha or at the physical body, we cannot heal the root. You can only cut one branch of the tree, that's all. Or you can just pluck the leaf of the tree. That's all. The root remains as it is. So to heal it from the root, you must go from within. All right. So that is why Pancha Kosha is very important. Then next is Vyuham in yoga therapy. What is this Vyuham? So it's like a arrangement or strategy, we can say. So what is that strategy? First of all, whenever you are giving yoga therapy, after you do course, you will be having certification. People will come to you. Okay. So first of all, yoga therapy maybe, or maybe you can give it in the groups also, but it can be a personalized approach, mainly because each one has different issues. Okay, so first, to understand the yoga therapy, you should understand these 4 aspects of yoga therapy. What is that? Those 4 aspects? The HEYAM, identifying the symptom. So what is, somebody please mute yourself. So what are all the identifying symptoms means? How a person will come to you, a woman will come to you to give me yoga therapy. She will just say that I have PCOD. Will you give it as it is simply by just saying that I have PCOD? So just you will start that I know this asana, I will give this yoga therapy to her. Do you think that her cure will happen or she will get all the relief? No. First of all, you have to identify the symptoms by becoming, please somebody mute yourself, by becoming a good listener. You have to listen first what she is suffering, why she is suffering. You have to observe her body properly. Whenever at first she won't open up also. So you have to make her open up in your way of talking. That is HEYAM, identifying the symptoms. Just by observation of the way she is talking, whether she is feeling stressed, whether she is sweating, whether she is shaking her leg, whether she is anxious, just by observing the physical body, how she is talking to you. This will come as a part of yoga therapy. Then Hetu, understanding the cause. Once you observe her or him, you will understand there is some problem is there. Yes. So what are all the causes? So once to know the cause, you should be knowing the aspects of the yoga. Okay. And aspect of the anatomy and physiology also. Without knowing that, you cannot go to the cause. Mind also is required, body also is required. Maybe you are good at mind by knowing yoga's concept, but you might not be good at body. To understand how the physiology is working, how the nervous system is working, which organ is inflamed, which organ is not producing certain hormones, you should know that. So understanding the cause is very important. Then based on that, you should define the goal. Yes, she needs to heal at that level. Whether it is at the mind first, okay? First her mind needs to heal, then slowly by default her body gets healed. Okay, so you should have defining goals. What level she needs healing first. whether you need to give only yoga nidra because she is more anxious, or whether you need to give pranayama, or based on her body, like it is in tamas, means stulata is there, so you may need to give asanas. So you need to define the goal, and based on her anatomy and physiology, which organ is affected, right? So then upayam, using tools for the healing. So first, when you make a goal, she need to heal at the mind level, then use the tool like yoga nidra, as I said, asana, or pranayama, or meditation, antarmauna, whatever is required. So this is how you will make a arrangement in yoga therapy. And I'm just going into the Patanjali Yoga Sutra for understanding, because the anatomy, physiology, you will understand. I will touch it at the end if the time permits. We just go into the slightly into the understanding of yoga therapy. Already in Samadhipada Patanjali Yoga Sutra, it is given that Vyadi, Sthana, Sanshaya, Pramada, Alasya, Avirati, Bhranti Darshana, Alabdha Bhumikatva, Anavasti Tatvani, Chitta Vikshepa, Te Antaraya. What are all these? Vyadi, diseases, mental laziness, doubt, carelessness, laziness. These are all here written. So you can see these are all obstacles. Okay, you might be thinking that no, this is for the samadhi level. Samadhi level, you might be thinking Yoga Sutra is for samadhi level. How can I live with this? This is not for me, for normal body. I have to live normal life. I don't want to be I don't want to go to samadhi level. No, you should understand here itself that it is for each and everybody. The Yoga Sutra is for normal lay person also, a very, very big saint also. It's not that it is only for a samadhi level person. So when you understand why women are now facing PCOD or thyroid diseases, do they have mental laziness? First, find out. Do they have laziness to do some work? Okay. Then they have doubt. Why they have doubt? Why they are eating outside? By eating outside, what are all the tamas is coming on the body, which is again bringing dullness on the body. That is creating obstacles. We have to understand the lifestyle which we are living. It is an obstacle. Obstacle for what? That how we are living life, that's how our mind start projecting out in the outside world. Let's go in. So based on those obstacles, our mind start working like dukkha daur manasya angamaya jayatva swasa prashwasa vikshepa sahabhuva. Those are all the obstacles are coming. Along with that, dukkha is coming. Okay, suffering is coming, sorrow is coming, mental diseases are coming, tremors in the body, anxiety, we are giving the name today, anxiety, fear is coming, insecurity is coming. Like if we have a PCOD, we think that I may get infertility, that itself, it's there itself, we start creating on our own insecurities. With that itself, I start getting more of anxious, the heartbeat is increasing, irregular inhalation, irregular exhalation. And that insecurity will not allow me to do my regular job. It keeps creating distraction. The disease which is coming in the physical body, it keeps creating distraction in my mental body. Yes, these are all accompanied that with obstacles it is coming. So we cannot only treat one thing like upper body only. We have to go inner. Then, yes, there is only one thing to remove all those things. Tat pratishedhartam eka tattva abhyasaha. Only one thing. What is that one thing? To come out of that. So you should not segregate, like fragmentation should not be there. Body is different, mind is different. There should not be duality. That you can heal the body, but you won't heal the mind. Okay, when it is one single pointedness, one thing you have to heal. You can take out different commentaries and you can get the different aspect. But in terms of yoga therapy, I am trying to tell you here that to remove that, you have to treat body, mind as one thing. If you are treating body, you should consider mind also. You should consider your energy body also. It's all five together you have to consider as one. Then only you can heal yourself as in terms of the therapy. Okay. Then what if you start healing, then chitta prasadanam, then your mind starts calming down. What are all these chitta prasadanam? Maitri, karuna, mudita, upekshanam, sukha dukkha, punya, apunya, vishayanam, bhavananta, chitta prasadanam. Why this is required? Maitri, friendliness with happy people, compassion towards the unhappy, or not unhappy, we can say those who are in the state of sorrow. And then mudita, joyfulness with who is virtuous people. Okay, those who are on the path of enlightenment or those who are supporting the society, with them you should express mudita, joy. Then upekshanam, equanimity, indifference, equanimity towards whom? Those who are even doing bad job. So in the society, but you should be equanimous. You should not get affected. So why these required? Because these four things, Maitri, Karuna, Mudita, Upekshana, this affects our mind. When somebody is doing bad things, we start creating dvesha, aversion towards such people. Yes. When somebody is doing very good thing, we start getting attached also. Then we start comparison. Why I am not having that? Okay. So this mind starts creating many more things. So what is happening in that mind itself? Duality is getting started. When I said here tat pratishedhartam ekatattva abhyasaha, you should understand there should not be dualities again in the mind also. Why we are suffering with autoimmune disorder? Our mind is always in a conflicted state. Always. There is no single answer. If somebody is saying something, we follow that. If this diet is coming, we follow that. After next 6 months, new diet will come. We follow that. But answer we are not getting. Why? Because mind want distraction. It's always running from, jumping like a monkey from one diet to next diet to next diet. But solution is not there. And in that changes, keep on changing, the body is not able to understand what to follow, what not to follow. Getting it? So, the first of all, we need to bring our mind at the stage of calming stage. There should not be we should reduce the content of the mind. All right. So next one. So this is tapa. What is the solution then? Tapa swadhyaya ishvara pranidhanani kriya yoga. What action I need to take? Tapa, austerity. Okay. What is that austerity? So first of all, we have to understand the austerity to dissolve the identity of I. Everything from the mind I am creating, the lobha, dosha, moha, matsar. At what level? Because of identity of I. Comparison all the time, criticism all the time. That mind is getting affected with that. And when the mind is getting affected, from the mind, it comes to the physical body as an illness. Duality is there at the mind stage. What it is going to reflect? It is going to reflect at the upper superficial stage at the body level. So one should understand how to dissolve the identity of I. So that only you can do that only coming up into the yoga. Swadhyaya, go inward and observe who you are. If the true human beings are there, then you will really try to dissolve the identity of I. I am not saying tapas means you should stand on one leg for 1 hour or 1 day or 1 month. That is not real tapas. Real tapas is within yourself. There are many defilements are there. You should try to remove those mental defilement to get rid of these physical ailments. Okay. Then Ishwarada, to know the ultimate truth. When you know the ultimate truth, even though a small suffering is coming on your physical body, any problem is coming, you will accept it. Because you know that there is no I, this body is not belongs to me. There is a real truth is there. Yes, that problem is there. I have to accept. You'll not be keep on crying. My suffering, my body, how I'll do this. That attachment, people, we create the attachment to our suffering also, attachment to our disease also. That is also a big problem. You know, it's sometimes aversion towards disease. I don't want to live with this suffering. So raga, dvesha, here itself, we are internally always fighting. Forget about outside fighting. Internally itself, we are always fighting. Duality is always there. So oneness, how can I see? Ishvara, how can I see? There is no chance, there is no silence within myself to see oneness. Okay? So the yoga therapy, bringing this point here is therapy needs everything from the point of yoga. So you should be aware of the moment to moment, your action, what action you are creating through your mind, what action you are doing it through your body, how you are speaking, body, mind, speech. You should be aware of the moment to moment action. Then only you can realize the yoga union. Okay, there is no conflict. Correct? So this is what. And then next is yes, samadhi bhavanartha. Kleshatanu karanarthascha. So why to realize the true nature? When you realize the true nature, when you cultivate the true nature by removing all those raga, dvesha, moha, avidya itself, okay, then you will realize, yes, suffering is there. There is a PCOD, there is a thyroid, but I won't get attached or I won't create dvesha also, aversion towards that problem. Even if I have a cancer, I have to accept. Healing will come. First, acceptance, surrender is required. Okay? So that for that, one should be able to sit in samadhi, or one should cultivate the samadhi bhavana by like antarmauna, yoga nidra. Okay? And this is what is the problems that avidya, asmita, raga, dvesha, abhinivesha, klesha. What are all these klesha? Always there are kleshas in the mind, causes of suffering. What are all these? Avidya, always living in the ignorance. Ignorance at what level? Of the mental tendencies. What I feel, it is good for me because my I want that. My big I want that always. And these mental tendencies are always dormant. We don't want to see that, or something superficially I'm seeing with all my indriyas, five senses. I'm grasping that, I'm getting attached all the time. So we are always looking at the superficial level. So that avidya is always there within us, in every human being. We are not trying to come out of that. Then asmita, yes, egoism is there. I want this certificate, I want name, I want fame. Always want to live in a limelight. Asmita is there. I want money, this much money, that business. Yes. Then raga, if we are creating attachment towards the children, towards it, and when something is not happening good in the family, I start like creating attachment emotionally or creating aversion towards that suffering, like dvesha. Okay, and then ultimately I'm coming to abhinivesha. With that, if I have a PCOD, I start creating insecurity that whether I will become fertile, whether I will give a child to this family or not. That insecurity start developing all the time. Even 10 times, maybe 2-3 times, doctor will say that you cannot. But if you can, you can do take all the efforts, and if you keep your mind in at one state, like completely open, calmness, peace is there, your mental tendencies, dualities are not there within yourself, yes, you can give birth. Infertility will not be there. So first, our own fear, our own insecurities has to heal. So healing is required from within. It's not that the physical body problem is there means we cannot heal. We can heal if at the mental level, if we start healing. So heyam dukkham anagatam. So we can avoid the suffering which is not yet come by practicing. Okay, so answer is this: yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi, ashtanga. Okay, ashtanga angani, these 8 limbs, by practicing these 8 limbs. Why yama, niyama? Why these moral qualities are required? If these moral qualities are there, then only my mind can walk on that path. If these moral qualities of yama, niyama I won't follow, how my mind will walk on that path? Why asana? Yes, it is Stiram Sukham Asanam. But why asana? Simply by doing so many asanas, the problem will get cured? No. First, you have to remove that rajas and tamas. What last night you have eaten, based on that, next morning your body will react. Sometimes it will be in the dullness stage. You have to go to yoga class, but you will not be able to go. Why? Because what you have eaten in the last night, that is creating tamas in the body. Or what last night, because of the work, you could not sleep. There is a lot of agitation, what to do next day morning. There is, I have a meeting, I have to present. A lot of agitation is, rajas is there. Then how will I come to sattva? The asanas. First of all, posture to remove the tamas, those who required stulness, whatever stool is there. So you have to remove that, and whatever rajas, a mental agitation is there, that you need to calm down by restorative practices. So this is what is yoga therapy. Person may need every day, depends on their day before activities or 1 month before activities. Based on that you have to decide the goal of yoga therapy. Then pranayama. Why pranayama? When you give after asana pranayama, you will give, then their mind starts to calm down. They will be able to sit at one place. Otherwise, some people cannot sit also because of anxiety. First, we need to give asana, see their condition. Or somebody is very, very rajas, mental agitation is there, start with the pranayama. Not everybody, see with which organ is having inflammation by understanding anatomy and physiology, then give pranayama. Everybody do not need Kapalabhati. Already organ is inflamed. In that, if you give Kapalabhati, it won't heal. It is going to aggravate the problem. So you have to understand that from the point of yoga therapy. Okay. So these are all required things. So again, in the first four sutra itself, Patanjali has given all the answers. First is Atha Yoganuशासनम, be here and now, to realize discipline of yoga. Okay, so discipline means what actually? That you are going on regular time. First of all, many of us can't follow the time itself. Forget the regular time. Time management itself will not come. It is again the tendency of the mind that I cannot follow the time. Okay, so at least start with the following time. The mind will come to that one state at least. This basic habit we can cultivate. Then you can see, wherever you see, no, I cannot do every time, it won't happen for me. Cultivate that habit. Discipline, bring it. Then mind will work on that direction. If always you will be saying that no, I can't do, then it won't. Mind will show you that way which gives comfort to you. So be careful. Don't go into the comfort. take efforts to develop that discipline. Be here and now. See what mind is showing by being present here. See it is how it is giving you comforting reasons to not to go to the class, not to go do something. Okay, so Atha Yoga Anushasanam. Yes, it is an auspicious way. There are many things, but when it comes to yoga therapy, so follow the habit by one single small habit to do it that time itself. Lifestyle, food on time. Yes, I have to eat. I will take 2 more minutes or 2-3 minutes. Yeah. Then yoga chitta vritti nirodha. What we have to do? Yoga is neutralizing the mind stuff. We have to completely nullify the content of the mind. It's not restraining, zero, making, controlling, suppressing, it won't work. It will come out like a earthquake one day, bombardment. So one should understand it clearly and one should address those contents of the mind in a proper right way, and then you can stop those contents of the mind. Various thoughts are coming in the form of vrittis that you can bring it down and reduce it ultimately. For that, yoga is required, antamona is required, yoga nidra is to go to at all the levels. Then that where you will see the seer. At that time, the observer becomes stable in his own form. Whatever the awareness you can understand as, yes, this body is required healing. Don't go to that level of samadhi. Just understand, yes, body is required attention. Your mind is required attention. Keep it simple. Tada drashtu swarupe avasthanam. Keep it simple. Don't go to the samadhi level at the point of yoga therapy. Think body needs attention. Mind needs attention. Observe it carefully. That is what it is trying to say. Then vritti saripvam itaratra. If you don't look after it, it will go in havoc. Body will show its different forms in different disorders. Mind will also start going to different level by mental illnesses. Fear, insecurity, name it. Neurotic, psychotic, PCOD, thyroid, anything. So, take care of the mind. Discipline, cultivate discipline with small habits. Okay, so this is what yoga therapy. So we have everything. It's not that in one course you will get everything asana, which asana is required, anatomy, physiology, because you should know what organ is affected, what organ is inflamed, how it is working in. It's not that one organ is affected means only one organ will have problem. No, whole body is problem, whole mind is problem. Okay. So we have yoga nidra. Yoga nidra will take you to one layer from physical to pranayam, pranic body to mind, mental body to emotional body till it will take it in. And why we need to see, some people cannot sleep also, insomnia. Or today's girls, if you see 2 o'clock, 3 o'clock, they are not sleeping. And early morning, they have to go again to the office. What is happening? In Yoga Nidra, even if they sleep for 30 minutes of Yoga Nidra, heal their mental problems, give them complete relaxation, each and every cell will come to the normal state. Otherwise, at the cellular level, there is a duality. They are not at all removing the content of the mind, because the mind, they are not at all sleeping. Whatever whole day is happening, just in that itself they are staying. Somebody please mute it.
Kindly mute yourself, please.
So they need it, that yoga nidra, to remove that mental content. Yes. So this is what is different stages of woman. Woman is going through different stages. So at each stage, her emotional health will differ. We have to understand that from childhood to puberty to maturity. In childhood itself, do not compare the child with any other child, because that is making their mental structure. at that stage itself, childhood and puberty. Do not compare. Understand their creativity, whatever they are good at, just take it in that way. Once they are matured, they themselves know, do not go to different diet patterns, do not, because it's a way of mind to follow different way, diets. Okay, the mind needs entertainment ultimately. Menopause, when you clear these three stages properly, menopause will be easier. Otherwise, if you don't clear this childhood, puberty, and maturity stage properly, then menopause will be again a big havoc, because here the your children are getting adults. You will have all the family issues at that time. All the physical ailments will come, and then that will come up in the old age also. So this is one by one stage we should look after. So this is what is yoga therapy. If you see the PCOD or menstrual disorder, these are all the problem, menorrhea and amenorrhea, dysmenorrhea. You will understand all this anatomically and at the level of asana pranayama in TTC2. And thyroid problems also, like why women are suffering with thyroid problems, that also you will learn. Then PCOS, why ovaries are just not getting, follicles are not getting formation into eggs. So how menopause affects our body. These are all. Then uterine prolapse also, why uterus is getting sink down. So these are all the things you will learn into TTC2. And this is what is required: 5 pillars: stress hormones, nutrition, detoxification, movement and fitness, sleep, emotional health, all are required. Okay. So with this, I just stop it. Thank you. If any question, we will go ahead. Right? Any question is there? No. So just want to clarify here, the women who are listening here, those who think that during menopause, if you are getting obese and you want to reduce a lot of weight by doing a lot of gymming and all, it's not good. Okay, little bit of fat is required for your body to maintain that estrogen level. Okay, the estrogen which is stored in your adipose tissues, which that will help you maintain your physical as well as mental health. That is why physiology of the natural physiology of the body will take care by little bit of maintaining the body fat. So don't go to gymming, stress yourself, and from the adrenaline, which estrogen is going to help you, you will just remove it completely, and again you will have mental agitation. So this is just a small advice to all of you. So once you come to TTC, you will learn this again. Right, thank you. Yeah, Hari Om. Right. Any question? No question?
All of you, please
Can
turn
we
on your
do
video. Just we want to see you all.
Yeah, Lata,
one question? One
Yeah.
question.
go ahead.
Can we do both the courses, ma'am, at the same time?
Sir said just one course at a time.
Both are in-depth courses, ma'am. Even one course itself is very challenging. We have seen you need to spend more
Okay.
time, both theory, practical, you need to feel it, and both is impossible. So even somebody wish to join, our Swamiji used to say, join only one course and learn better. It's a very in-depth course.
Yeah, okay.
Yeah, it's a very in-depth and detailed course. Few of our alumni are here. So if you check with them, you will get a like wide knowledge about each and every diseases, anatomy and physiology, asanas, like yoga treatment for the particular diseases, as well as yoga nidra meditation. Everything is detailedly explained by the experienced teachers. So
Soumya ma'am, the course starts, suppose start from coming Sunday. It may get postponed by a week. So maybe like this Sunday is not there, next Sunday will be there. This is the course starting. You have put a message in the chat. You can note down our number, ma'am. You can course fee. We have said, ma'am, course fee is 14,000 rupees for TTC1. Again, TTC2, 14,000 rupees. Yeah, it's online, fully online. Happens only on Sundays, except 1 or 2 Saturdays, mostly on Sundays. Exam is also online. Everything is online. We have Viva, we have intermediate, the assignments, exams, objective and long answers, all kind of things will be there.
And
You
mini
need to put
projects
all the
also.
effort to finish the course.
And certificate we are issuing is very valuable. And using that, you can join in an institute or you can take your classes on your therapy classes on your own. And I have posted my number. I am Vanishri. I'm the course coordinator. I have posted my number also in the chat box. Feel free to call me to know more about the courses, this course and other courses.
The teaching will be in English only. But if you want to ask in Tamil, we can answer. But teaching will be in English only. Can you again post the number? Manishi ma'am, can you please post the number, ma'am? It is there in the poster also. You can see Vanishi ma'am number in the poster also, what we have circulated. Now Vanishi ma'am sending in the chat group also. You can talk to her for further details.